Hello, I'm Dennis Pullin. One of my favorite parts about being president and CEO of Virtua Health is getting to know our colleagues and the many ways they are here for good. Each person contributes to healthy communities, and each person has a story to tell. Samira, thanks for joining me on the Inside Edition of Here for Good.
Thanks for having me.
You started in nursing at Virtua, decided to leave to go work for another organization. What drew you back to Virtua?
I left Virtua. I was here for about 2 years as assistant nurse manager in the ICU at Mount Holly. Shout out to Mount Holly. When the opportunity of a risk management and patient safety position opened up at a prior organization I worked for, and it felt like a good opportunity. So I left, and as soon as I left, I realized that I was not where I am supposed to be. The culture, the people here, the innovation, when you work elsewhere and you're trying to do new things and premise new endeavors, and you just keep hearing no, keep hearing we can't afford it, we can't do that, that will never work. Those are not the things you hear at Virtua, and I knew this is where I belonged.
Since you have been back, you recently were promoted to assistant vice president. So congratulations on that. What's that transition been like from being a nurse to now really in risk and patient safety?
I was a bedside nurse for 10 years, a nurse manager for 2 years, and I really thought I knew some things in the hospital. And joining, this role, and you see everything from a totally different vantage point, and you can fully appreciate I think the word that you used before with me, with the ecosystem that is, the healthcare and
it is a large ecosystem that requires the inner working of many, many different parts.
Absolutely. So it's been such an eye-opening experience. It's been exciting. And it's really an honor and a privilege to be able to do this work in an environment like this with the support of my leaders.
Tell me more about risk and accreditation and patient safety. What does your role currently entail, and maybe even what are some of your main priorities?
My role is sort of dual. Half of it is, accreditation, regulatory compliance, joint commission readiness, and making sure that the organization is where it needs to be so that when we have these surveys, whether they're, unannounced or scheduled, that we are where we need to be. And the other portion of it is that patient safety and risk management, and that is reviewing safety events that might occur that are reported to us through the occurrence reporting system, and doing causal analysis to analyze and get down deep into what actually happened so that we can put in a system failure and prevent harm from reaching the next patient.
Being on this high reliability journey as an organization, putting quality and safety at the forefront of everything that we do you find that our colleagues are embracing that mindset?
Here at Virtua, at least, we realize that it's no longer acceptable to tell people to just do better or work harder, try harder next time, and don't hurt someone. And they understand that we understand that aspect of it, and that we are going to do everything we can to make our system strong, because no one comes to work to harm a patient, right? It's their worst day of work as well. And so we don't want our staff to be that second victim. We don't want patients to be harmed. And moving towards that direction, I think that the pulse in organization is there, and colleagues understand that aspect.
So and we are here today because of several conversations you and I have had in the past. I remember one of the terms you used was unsung heroes of the hospital. And I think at the time you were referring to the Central Sterile Services Department. How does departments like that play a part in keeping patients safe?
Yeah, absolutely. CSS is an amazing example. It's my go-to all the time. It doesn't matter how great the surgeon is, if the instruments that they're using are dirty or not
The
not
outcomes
good.
aren't going to be as we hope, right?
Exactly. And so they are the ones that are often down in a basement of part of the hospital and doing all of that work every day. The meticulous cleaning and disinfection and high-level disinfection and sterilization of those instruments. They are the ones ensuring that their HRO principles are being demonstrated through everything that they're doing, and that it's translating up to the outcomes and the patient on the table.
How do you keep them connected in the journey and making sure that they recognize their value in this ecosystem? Do you find that to be a challenge, or do we have the right systems in place to where they know how important their work is?
Well, I think it's really interesting. The Joint Commission surveyor during our last triennials recognized one of the CSS directors as their HRO hero. That was the term that they use. They go to every hospital and they make that they coin someone with that title, and we are actually going to steal that title. And our plan is to make a recognition for HRO type of heroes, for HRO principals.
We both have very demanding professional lives, but we also have some hobbies in common that I don't think you are aware of. And that is one of being a mixologist. We both attended bartending school, not together, but I went to bartending school probably 25, 30 years ago, and I know you've done the same. So tell me about your bartending adventures.
I went to bartending school not out of necessity. I was actually already a nurse at the time, already working in a hospital. But
I was a hospital president when I went, so I get it.
I just wanted to learn how to make great cocktails. I wanted to learn, there's a special social aspect to mixology and cocktails and the relationship building and celebrations. And I just think it was a really cool aspect that I wanted to embrace and to learn more about. So I did go to bartending school. I worked for a bartender for like maybe 3 months. It wasn't for me. It wasn't fun when it was a job.
No. Do you have a specialty cocktail that's sort of your go-to or that you really enjoy making?
Yeah, I mean, personally for myself, I'm a whiskey drinker, so
Same here.
yeah, whiskey sours and things like that. I did make a really cool green drink for the Eagles Super Bowl last year, like a green lemon drop.
You didn't have to go there.
You would have liked it.
And I did notice the green blouse, but mine is a blood orange straight up margarita, which I absolutely love, tequilas and bourbons, but that's a whole nother story. But I know also that you are deeply involved in community-related services, particularly through your sorority, Alpha Kappa Alpha, right? Tell me about what that involvement means to you.
Alpha Kappa Alpha Sorority Incorporated is so near and dear to my heart. It's the oldest African-American Greek letter organization, and it's just pivotal on sisterhood and service. So it's been, I get so much more back than I could ever truly give. It's an international organization, so wherever we are. I'm actually in a chapter in Delaware right now, but I will soon be transferring to my soror Rhonda Jordan's chapter in New Jersey.
But it is all about service, and I
Yeah.
think a lot of people don't realize, one, that is the core to its foundation, but for you, with a nursing background and a service orientation, I would think that brings you a tremendous amount of joy.
There's so many programs and events that we host for children, prom dresses for girls that are coming up on junior, senior prom, or different aspects like teaching kids how to balance a checkbook through our debutante program, things that you might not always learn from your parents or in school.
I think those are the types of things that make Virtua such a special place. Yeah. And it is truly the definition of being here for good. And we have so many colleagues that are doing such wonderful things. I get so much joy out of being able to highlight those things on this show. I know also that you're part of a book club with other mother friends of yours, and you guys, what types of books do you read, and do you sort of mix mixology with the books? And I hear there's this exciting book that's out and is doing really well, and all the proceeds are being donated to Virtua's foundation to support food insecurity. I think it's called Here for Good. Are you familiar with that book? Have you read it?
Or maybe Suited for Leadership?
Yeah. Something like I was checking to see if you picked up on that.
Yes. So we're moms, so we need romance in our lives, and I have not nominated your book yet.
Okay, so in other words, you need to be entertained, not educated. Is that what you're trying to say?
But I have read your book.
Okay. So this book club.
Yes. It's a really just a great opportunity for my mom friends. It's moms who have little kids to kids that are out of the house, and just that ability to refresh and connect, and just understanding that camaraderie, and you're just all just trying to get through it together. We do try and mix it up and do cocktails that are like themed to the book, so that we can shake things up. But we are more of a romance. We just read the Book of Lost Names. That was our last read, and so it's been an incredible ride.
What would you like your other virtual colleagues to know about the space that you work in terms of risk, in terms of accreditation? Is there something that you would like to leave our audience with that perhaps could give them a look inside of the world and the importance of the work that you and your other colleagues do on behalf of the organization?
I think I would like, especially our clinical staff, the end users taking care of patients every day, to know that we are doing everything in our power to make it easy for you to do your job and take care of the patients. We are working so hard to ensure that you have everything that you need, that you can be successful taking care of patients in a safe way. I think sometimes there's a disconnect between the work that's going on up here and the work that's going on the units. And we try so hard to ensure that we bridge that, but we can't reach everyone necessarily in such a large organization.
But you do approach it from a collaborative perspective.
Yes.
And not being that department that's looking to find areas of weakness, but looking more to find opportunities to better improve care.
Yes. And then finding those opportunities and going to the people who are doing the work and asking them how we fix them. That deference to expertise, one of our HR principles, is extremely important, because they're going to be the ones that can tell us the parts that we can't see from a chart review or that we can't see from a literature review. They're going to tell us the intricacies of their day-to-day and what we might be missing to put the piece into that puzzle.
Well, Samira, I am so appreciative of the work that you and your colleagues do on behalf of Virtua, and I can't thank you enough for joining me on the Inside edition of Here for Good.
Thank you. Thank you so much.
This has been yet another great example of one of our colleagues who truly defined what it means to be here for good. So tune in again for another episode of Here for Good, the Inside Edition.